Thank you for joining us for the Women's Heart Health Summit. I'm here with Dr. Mark Tager, and we're going to explore some new ideas about resilience and try to help deliver some pearls for you about how to make your days better, your life stronger, and how to deal with the stresses that all of us are experiencing. Dr. Mark, thank you for joining us.
My pleasure. Now, if I call you Dr. Mark, then we do Mark too, so we'll have to be careful about that.
Well, we've known each other for a couple decades, and I've always respected the work that you've done. Dr. Mark Tager is a graduate of Duke Medical School. He's certified in family practice medicine, and he's really been the teacher of doctors. He's been training doctors to become better doctors and to be better at what they do. So I think we're very fortunate for our listeners to be able to actually listen to a doctor that teaches doctors. And he's going to talk a little bit today about some of the ideas of resilience and really how to help us deal with the stresses that we deal with in our day-to-day life. But first, I'd like to just kind of back up a little bit, Mark. And you know, you've been in medicine and healthcare for a long time. You've seen so many changes. What are some of the things that you used to see that you feel like are now moving forward? And let's talk a little bit about what the future of medicine may be.
Well, I think we're coming full circle. In the 70s, I was one of only two medical students in my class who went into family practice. Also at the time, I got into yoga and meditation and started looking at the importance of diet and exercise. And it's interesting because we've had this wellness movement that's just really finally taken hold. So if you go into LinkedIn and you type in the word wellness, you'll see there's about 7 million hits that you get. So that concept of not just quantity of life, but the qualitative aspects, they've really taken hold in America. We see that in a couple of places. Obviously, we see that with the baby boomers. You know, we see some 70-something million Americans that are, trying to stay strong and resilient for the challenges of life. But we're also seeing a new dynamic, and that new dynamic perhaps comes from the millennials, 73 million millennials in the United States. But no longer is the doctor the benevolent dictator. Yes. The physician is now the partner. And this is, these young people have grown up in a sharing economy. They're used to working collaboratively. So we're moving away from this concept of an M-deity to a partner, from a dictator to a guide. And so in the training that I do with a lot of healthcare practitioners, we train them on the concept of how to be their patient's guide.
Well, that's so powerful. And I know for so many women that I take care of, they go to see their doctor and they're not heard. They've really not ever had their story told. And one of the first things we ask is, tell me your story. And we sit back and listen. Mark, I think we were told that the average doctor interrupts his patient within 11 seconds of them trying to tell their story. So that's the beauty of the integrative model, the functional medicine model, is that it's a chance for women to really tell their story and to be heard. And I think that's so important, these listening skills that we're developing in physicians now.
Well, actually, there was a later study that followed up on that and showed that physicians have made great improvement. We now interrupt within 23 seconds. So we've more than doubled the improvement there. So you're right, it is this concept. And what happens is, the integrative functional anti-aging model really revolves around what I call tincture of time, T-I-M-E. You need time to spend to get to know that patient. Now, the problem is that is really very difficult and very challenging in an insurance-based model. So we are seeing that's another enormous movement, the movement towards membership models in health and direct pay. It's fueled in part because, there's such high deductibles people have right now. Yes. So they're paying this money out of their pocket anyway. So they are becoming much more attuned to the entire experience. We call that the patient experience, the patient journey. But in essence, the new competition for many practitioners is not the doc down the street. It is essentially you're competing for a new outfit, a family cruise, a nice dinner and a trip to the movies. So we've got to be able to become more consumer-centric in what we do and meet and exceed our patients' expectations.
That is so true. And here in Jackson Hole, the state of Wyoming, we only have one insurer, and most people have these very high deductible plans. We encourage people to get a health savings account. That's pre-tax money you're able to put into the bank. And actually, basically, you come to see me and your visit is almost 40% less because you're using pre-tax dollars. That's a smart way to do your medicine. And I think you're right, Mark. I think a lot of people are really seeing that health has value. And when they compare it to what they're spending in their day-to-day life, the analogy I like to use is that if your car's transmission went out and you took it to the garage and got it estimated, it'll be $1,500, $2,000 for a new transmission, but you won't think twice about either buying a new car or a new transmission. You need it. So it's interesting how we don't see the same for our own health.
If you go back to this concept of tincture of time, the problem you have when if you look at the woman who's 35 to 50, who is having hormonal issues, usually what happens in the conventional visit is she is told that it's all in your head. It's a normal part of aging, or here's a script for something to help you sleep. And really what needs to happen is that much deeper dive into the connections between the gut and the brain and the hormones. And that sort of diagnostic functional workup can only take place in a really good collaborative kind of relationship. And fortunately, we're seeing that there's many associations right now that are training physicians in this, well, sort of new but old way. In 1979, I wrote a book called Whole Person Healthcare. And I like to think that those concepts of treating the whole person, be it a body, mind, spirit concept, be it an integrative concept, be it a functional concept, being an anti-aging or regenerative concept. But we need to go back to that, given the fact that, what happens 4.3 million times a year, people just get prescriptions. So we know that that's not the answer. We know that there's got to be an exploration of lifestyle, and you need a guide. You need someone to work with you. Does it have to be a physician? No. Can it be a nutritionist, a naturopath, a chiropractor, a health coach?
Yes.
And it can be any one of those, because you just need that person to give you the knowledge, the support, and help you find your why, help you tie into the motivations that are going to help you make lasting behavior change.
Well, you mentioned your book, and I've read several of your books, and you're the CEO of ChangeWell, which is a human performance company training people, and you help doctors go from good to great. So I feel like you have a lot of pearls, and we've talked in the past about resilience and how you build that, develop it. And really, I love the concept of performance. Whether you're a CEO or a supermom or a physician, we all want to be better at what we do. And I see that tying into performance. Just like an athlete trains for performance, we need to do the things we need on a daily basis to perform better at whatever powers our passion.
Sure.
How do you see that tying into the resilience and performance, if I may ask?
Well, it's a spectrum. And the earliest wellness exercise that we used to do in the 70s was a very simple one. We basically talked about, I hate this term, but low-level worseness, fatigue, disease symptoms, lack of energy, no stamina. And we put that over here. And then we said, well, let's talk about being the best you can be. Energy, performance, vitality, lack of health symptoms. Then we said, okay, this is 0. This is 10. Where do you rate yourself on this continuum?
Right.
So we call it the worstness wellness continuum. I did a book years ago at Planning for Wellness, and I think an 81. And we had this continuum. So we would ask people, where are you right now? And so there's some people who rate themselves 4, 5, 6, 7. But the real pearl of this exercise is the second question, and that is, in which direction are you moving? Now, of course, we'd always have a couple of people from California who gave themselves a 10, and we had to tell them that it doesn't stop at 10. So, I'm perfect. So, but the resilience piece is very interesting for me, because In the early 80s, I saw a commercial for an extra strength pain medication. It said, life got tougher, we got stronger.
Yes.
I wondered, I would see two patients with very much similar conditions, but one would seem to wilt and the other would seem to thrive. And I began to wonder, what were the ingredients that created mental hardiness or mental physical well-being? So I came up with a system. I've trained for many, many years. I've probably done 700, 800 trainings on this subject all around the world. And the concept is that there are skills that all of us need, and then there's skills that some of us need, and then there are the skills that you need. So the idea was to get a funnel and to be able to create a sort of a model. And we divided that into the skills that all of us need. And those are 4 C's: control, challenge, commitment, and connectedness. And those are things that, you can kind of go down a checklist and look at the extent to which you are in control, have a perceived sense of control, whether you are at cause rather than at effect. Are you doing the kind of things that build up that sense of self-control? You and I both ask people to exercise. We know it's good for your heart. We know it's good for your bones. We try to get people to exercise all the time. There's another reason though, and that is when all you have to do is put one foot in front of the other,
yes,
or one stroke in front of the other, or one more revolution of the bicycle. For that moment in time, you are in control. And this sense of control is a really important one. And we go on to talk about other things: challenge, connectedness, and commitment. And those are some of the big C's. But sounds like one of those late night commercials, but there's more. So years ago, we used to do a lot of personality training on different instruments. And you know what I found? I found that people have temperaments. They're sort of nature and nurture. They're kind of cast in stone. Anybody who has more than one child knows exactly what I'm talking about. You look at your kids, and by the time they're about 5 years old, you know what you got. That one's like this, and the other one, that one's like this, the other one's like this. And what bothers one doesn't bother the other. What motivates one doesn't motivate the other. What stresses one doesn't stress the other. So we came up with an assessment called the Power Source Profile that was tied to stress and temperament, stress and personality. And I use it to explain the fact that my 2 kids are so different.
Well, the stress I get asked a lot about, is stress good or is stress bad? And my favorite story is several years ago here in Jackson Hole, we had a 4-foot snowstorm, and the first person walked in and she said, "Oh my gosh, I love it when it snows like this. The trees are beautiful. The mountains are beautiful. It's my favorite time of year." The very next woman walked in and said, "Oh my gosh, I hate it when it snows like this. I'm going to fall and break my neck." So the same 2 external stressors had 2 different internalizations.
Yeah.
So it's really developing those skills and that mindset you're talking about. It's developable. You can change your internalization.
This is interesting because we teach that the perspective you now hold on pretty much anything is just one of a number of perspectives you may hold. And your power, you get great resilient power by having an ability to reframe something. So it's not only just the perception in the moment, which is important, but is the capacity to look at things in a different light, to step back. And one of the real challenges with social media is there's no filter, there's no perception, there's no stepping back. So there isn't the opportunity for the reflection that we need to sort of be well and be hardy. So that's a great story. I think I'll take that on the road with me. I like that. That's better than the story that I tell.
Well, I do think, we look back at the ACE score, which has just been redone at a larger database. This is the adverse childhood experiences that we're seeing. What happens to kids really reflects some of the health challenges they have as adults. And so really this concept of early stress and late disease, I feel like you may be able to shift that by learning some of these 4 C's and some of these other skills that you're talking about.
Well, that's really really interesting because we know from telomeres from that these early childhood adverse events actually will increase the rates at which the telomeres, the end caps of our chromosomes, begin to deteriorate.
Yes.
And that determines the longevity of every cell. And then, of course, layering on top of that, and you are one of my experts and gurus in this, is the field of epigenetics. So what happens is that these childhood events and these adverse events then express themselves in the expression of the genes, and the SNPs get turned on or off. And so we carry this legacy of stress-related damage with us throughout our life, and we pass that along to our children. Now, when you try to explain that to people, it's just, and in fact, when I first thought about that, I said, OMG, that is just, it's just a mind-blowing concept. So I think our goal, it's really lovely that there are so many people into wellness, into training, yes. Meditation and mindfulness and yoga. I used to teach yoga. When I first started my practice, I stepped back and I wasn't happy in the late 70s with how traditional medicine was going. So I said, if I were ill, what would I do? I'd want to go to a doctor and say, I want to buy an hour of your time and pay you for it. And then I want you to teach me what I need to do. So I set up something called the Institute of Preventive Medicine in Portland, Oregon, in 1977. And I saw patients for an hour at a time. I think I charged $25. That was a lot. That was good. Maybe $30. I don't remember. And we had a series of classes and workshops. And I had other healing professionals with me. And I would teach yoga. I would teach a Monday night yoga class. And that's something that's so delightful to see, the explosion of yoga. Now, we recently had, not a few years ago, a big debate in one of the schools as to whether this was brainwashing our children and that they're going to all turn into yogis. And fortunately, the yoga folks won. And this concept of stillness, of mindfulness, of meditation, that capacity, being able to tap into that capacity is a really great one. So, and I'll just make one little point about that. We're recording this on October 2nd. It is Gandhi's birthday and my dad's, who passed, his birthday. And I guess the concept there is that I like to think and describe this mindfulness sense as being Buddhistic. Now, Gandhi's no Buddha, but this capacity to be in the moment, to be present, and to learn to let go of that which you can't change. That is the hardest thing, because people who, on my system, Power Source Profile, are highly creative and highly relationship-oriented, they can awfulize. Now, what is awfulizing? Awfulizing is you're laying in bed at night and your mind is churning and you're thinking of the worst possible scenarios and how you made someone feel. This capacity, and this gets back to control again, the ability to learn what is important and actionable, where you need to work on something and what you need to let go. And letting go doesn't mean you don't care. It just means that you recognize that it is a waste of your energy to go and put more focus on that particular thing when you can't do anything about it.
Wow, Mark, that I'd encourage all our listeners to stop right here, rewind that last section, and listen to it.
Take a deep breath, sit up straight. Wait. Well, they might as well sit up straight, relax.
Yeah. Do a couple belly breaths. But you're absolutely right, and you've touched on 3 or 4 things there. And just to break it up a little bit, this idea of the epigenetics you mentioned genetics is one of the most complicated things. We have Ben Lynch joining us also on the summit. He's my go-to guy, and so definitely listen to that one. The easy message I feel that I can share with our listeners and with my clients is you're not doomed to be your parents. You are not doomed to have the same gene expression they did. You have the power in your lifestyle choices to turn on good genes and turn off bad genes. That's very powerful. So you're not doomed to be your genes, and you can manipulate your outcome based on making good choices. That's the power of lifestyle medicine.
Yeah,
You also
that is
talked.
one of the most powerful messages available today.
Yes.
And I do have a concern with so many people getting their direct-to-consumer genetic testing. First of all, it still always needs to be interpreted, hence
Mhm.
work and the work of some other companies that are doing some interpretations, so that you get all these SNPs, but you don't really know what's clinically relevant, and so they need to be interpreted. And so I think that's an important piece of the.
Yeah, I think there's a lot of danger in genetics. We know just enough to be dangerous. But the message is still clear there, is that your choices turn on good genes and turn off bad genes. As we
Absolutely.
learn more about who to turn on and who to turn off and how to do it best for each individual, that could be a game changer. But right now, it just empowers people, which I think is what our best skill as physicians is to help empower people. Let's provide them with knowledge to empower them with good information that helps them make behavioral changes based on their belief systems. We're taught in medical school to motivate by fear and guilt. Doesn't work. So I tell my clients, the plastic surgeons in Beverly Hills, they won't do plastic surgery on smokers because they know those women won't heal as well in the skin. That's a shocker. One of the models whose father died of lung cancer took all these models and aged them photographically based on if they were a smoker or not. So, you got to kind of tap into people's hot buttons and what's really important to them. So when you show a picture of lung cancer, it's hard to get someone to quit smoking. But for a woman, showing them that the effect on the skin of the face with smoking. And for men, we show them a picture here in Wyoming of a cowboy with a limp cigarette because smoking causes erectile dysfunction. So it's really getting past the science and getting into the day-to-day. What really is important to the person sitting with me that I can really help them to want to make good decisions to turn these on? You mentioned yoga. The most powerful thing in my clinic is someone doing a mind-body medicine practice, whether it's deep breathing, guided imagery. You also talked about the health coaches and this concept possibly of group visits. There is power in a collectiveness. And that's
Yes.
one thing I wanted to ask you, with your experience training so many doctors and people and focusing on how to perform better. How do you see these group dynamics working, like in a yoga class or in like a group visit with physicians, which is becoming more popular?
Sure. I just, the group visit was started years ago by Edward Nofsinger at Kaiser Permanente. He called it DIGMA, the drop-in group visits, basically. And I actually just came back from teaching this weekend with Shilpa Saxena, and Shilpa has a great group visit toolkit, and she's been just pushing and teaching practitioners to bring people together and work in groups. This kind of gets to the fourth of my C's: control, challenge, commitment, and connectedness.
Mm-hmm.
So
Great.
There's this concept of social support. And if you look at the psychological literature, we know that people with friends and close connections and family ties live longer than people who are lonely, who have fewer social ties. So there's an enormous power of getting the group. So the physician doesn't feel that I know everything, I'm going to tell you what to do. We call it, we should on your people. You're shoulding on them. You should, you must, you have to. And when you get off that and you recognize that you can be first a guide individually, but then even more important, a facilitator. So when you bring people together in a group and educate them and train them, they get group support, but also someone in the group will say something that resonates in a way that you never could have said that because you don't have that condition. I mean, you're a healthy 50-year-old doctor and you look great, and people say, well, gee, it's easy for him. He's got a full head of hair. He looks good. He's strong. But it's hard for me. And when they hear that same message coming from someone in that group. So the other thing that I think is so important, we really have a dearth of primary care doctors in America right now.
Yes, we do.
By 2020, it's estimated that we'll be down 90,000. The good docs are retiring. So we need new ways of bringing efficiency to healthcare and new empowerment. And I think group visits certainly do that. So I can't see why doctors just don't make that. Well, actually, they're beginning to. It's about 10% now. About 10% of the primary care physicians in America are doing group visits. There's no prohibition from Medicare for doing that. In fact, they encourage that. The American Academy of Family Practice encourages it. So it is a great system. But there's something that happens when you get in that collective, in your yoga class, or in a group where you're doing any sort of opening up. That's a great thing.
That social connectivity is so lost with this plugged in generation that we're coming in, and seeing two teenagers texting to each other instead of talking to each other. And I think you're so right. This idea of sharing and being vulnerable and having someone see something in themselves in another person makes it less dangerous and scary. And they're able then to address it within themselves. It's a very powerful tool and a message to share with people.
Yes. It's giving permission, actually, to voice inner thoughts and inner feelings and the doubts that we all have. I mean, let's face it, if I were to hook up a recorder to your brain and get a recording of everything you say to yourself in the course of a day. Now, of course, for some of us it would be X-rated, but for the most part, these internal doubts and fears. Now, I'll tell you something else that's really interesting. I do this 1 or 2 day program called Enhance Your Presence. And we take practitioners, mainly integrative, functional, but healthcare practitioners. And we have them go through a day or 2 day intensive experience to figure out who they are and where they're going. And in every single one of them, there's a moment where they break down and they go back to a painful period of time where they lost a parent to a disease, where a brother was maimed or killed, or some sort of an experience that kind of wounded them. And I think within a lot of practitioners, there's a wounded healer. And when we ask them, in fact, to tell a story of great authenticity, usually what they do is they go back to that point, that little spark of pain and epiphany that kind of drives them. And for so many of us, we all have that little bit of that pain point. Yes. That just sort of has to come out. And it can come out one-on-one when you're working with the patient. It can come out in a group. But in order to find your authentic voice and to be who you are, maybe it comes out when I'm looking at the mountains in back of you, when you're walking in the woods and staring at the mountains. But that we have to tap into that, because that getting over that is the basis for healing and the basis for power as a person as well.
You're talking a little bit earlier essentially about forgiveness, which is actually a selfish thing to do. You're allowing yourself to forgive, which is a very powerful act. One of my tricks that I do with my clients here is I have them walk along our river carrying a little rock. And I have them think about who they resent, all that energy that person holds over them, and let that rock embody it. And at the turnaround point, throw it in the river and let the river wash that away. It's amazing how a couple of those experiences, and whether you say a blessing for them, a prayer for them, or wish good things, or do this physical, carry a rock or a stick and put it somewhere and just let go of that. It's a very powerful thing. So being vulnerable yourself, but also letting go of the energy other people hold on you. And for the heart, I think this may be the most important thing, is that resentment, that anger. We talked about stress. Stress actually may be good for the heart. It's the angry stress guys, those type A, particularly men. It's the type A men that are angry and hostile. That's what Dean Ornish and others have shown. Those are the dangerous personality types. So
one of my classmates at Duke did some of the early research on that. Absolutely, that anger. It's the anger that's a destructive. Now, I've got a book and I did some years back called Transforming Stress into Power. And we essentially take the viewpoint that you need stress. Without stress, you wouldn't wake up in the morning. You wouldn't get a degree. You wouldn't strive to put bread on the table. Well, gluten-free bread anyway. on the table. But you need that. Stress is a natural, normal force for performance. And you use it. I stress myself to write books. I'm working on my 10th book now.
Great. Congratulations. Great.
It's stress, but it drives performance. And And you need to have that in your life. You know, there are people, there's a bell-shaped curve. And it's, on one hand, we have rust out. Now, rust out is when you go to the Department of Motor Vehicles and, can I help you? Can you work any slower? A rust out is a teenager who doesn't have a job in the summertime. You know, that's rusting out. On the other hand, we have burnout. Now, burnout is not a great term, because actually the better term is called compassion fatigue. And it is really a consequence of really caring and getting this emotional hurt that comes from the fact that it doesn't matter anymore. Depersonalization, yes, is a big part of it. And that is the interesting thing for clinicians, because, you know, if you see 25 patients a day and you are a caring, concerned physician, and you realize that you have maybe 5-6 minutes to talk to them, maybe 3 or 4 minutes to talk to them by the time you're done, you know, typing on your EHR and getting their information and, you know, looking over like that. It's a bit of an internal paradox, because you want to help them. You know they need more than what you can give, yes, and yet you're going to wind up writing a prescription or sending them to another practitioner. It was really interesting because, you know, in integrated medicine, we talk about these silos. I just had that experience in my own family with someone. You know, she got moved from one silo to another. No one was really interested. By silos, I say cardiology, pulmonology, gastroenterology. Everyone is into ruling out the disease condition, yes, that is within their specialty, but no one is really looking across the spectrum to find out the root cause and really what can we do to get this patient better. So I think that's another piece of the equation that's being solved by many of the functional medicine physicians, integrated, yes, medicine physicians are really looking at that. But it takes time, it takes tincture of time, and it takes some skill, and it takes motivational interviewing, which is, instead of shooting, you sort of ask those open-ended questions. You know, when the patient comes to you and they say, well, doctor, tell me what to do to lose this weight. Well, tell me, what have you considered in the past? And what do you think is going to work for you? So we begin to share this responsibility. Now, the nice thing about it is that so often doctors and CEOs go home with the weight of the world on their shoulders, because, you know, they take on all these problems. When we begin to share as physicians the burdens with the patients, and when we recognize that, boy, there's a lot more of them than there is of us.
Yes.
And we balance that off better, we sleep better at night. They get better outcomes. They get healthier. They get empowered. You know, we talk about patient empowerment, and it's really the ability to help guide our patients to tap into something that is deep within them to make meaningful change.
Well, such powerful wisdom, Mark. I really love the way you think about yourself, your clients, patients, and really society as a whole. It's so tied together. One of the skills I learned from my father, who's a physician, is to find something that turns your passion on with every person you see. I come home from my days of a long clinic excited and more energized than when I left in the morning. And I think that's something that, as integrative functional doctors, we all came here for a reason. We had ourselves, or for me, it was irritable bowel syndrome. I went to every doctor and nothing worked. I played college and pro soccer. I couldn't eat on game day because I would be in halftime in the bathroom. But we all have these personal stories of what medicine didn't do for us or a family member. And those silos you talk about, I call them having too many ologists on your team. No one can really tie the whole story together, but having someone that can look at your story and connect with you and find out what's important to you, what's worked for you, what hasn't worked for you. And let's develop a plan that's personalized. Root cause medicine, as you mentioned, a precision personalized plan for each person. That's where this is all headed. And people are becoming empowered. They're now coming to see me with a lot of homework they've done. Most of the other doctors don't want to look at it. They don't want to see the 20 pages of history and all the questions. I love all that data. I love having a patient involved. Yes, it's more work, but it gets me to a level. And if they know that I'm going to take the time and look at it and connect with them, they have a chance to actually get better. it's really a win-win situation for everybody.
So when you flip it around, let's look at doctors for just a minute. And we teach this model of presence, the book I did, Enhance Your Presence. And it's really interesting because it's a combination of intention and attention. Now, you've got to pay attention to that patient. You have to be mindful. But the problem with mindfulness is it stops in a certain place. Intention is your intention to help heal that patient. Now, you take that with a set of skills and the new skills, the skills as you were speaking of, precision, personalized medicine, functional, integrative skills. And you learn those skills and you perform that with passion. You mentioned you wake up and you go, at the end of the day, you're excited, but there's more to it. What the goal is for all of that, and this is a little different, and it's not to necessarily reduce your A1C, your markers for diabetes. It's not bringing down your cholesterol, although that's really all important. It is your ability to take your intention and your attention, your skills and your passion to create a possibility in the minds and hearts of your patients.
I love that.
If you can do that, and that's the model we teach, and that's the model in our book. And if you hold on to that, it's so powerful as a practitioner, because your goal is to create that possibility of a better world for them, a healthier world, a longer world, living to see their daughter get married. It's the possibility. We are instilling little seeds of possibility. And if you think about that as your job, okay, yeah, sure, you want to, clear up their rash and, get their tummy together. And there's ways to do that. But really, underlying all of it is this ability and the need to create possibilities in the minds and hearts and spirits of our patients.
True words of wisdom, Mark. I just love every time we have the opportunity to get together and to chat. And I so appreciate you being here. Again, Dr. Mark Tager, graduate of Duke Medical. He's the CEO of Changewell, a human performance training company in San Diego. You've got 10 books. And Mark, how do our
almost dead. These dark circles are
how do our listeners find you if they want to learn more about the work you do?
Oh, they can just go to changewell.com and sign up. We have a number of interesting things we do. We have a series called 3-minute videos on America's leading motivational healthcare speakers. I've got information. We've got a course on presence, on principles of presence, how to get strong and tougher. So, and I try, they can hit me up on LinkedIn. I try to actually look at everyone's LinkedIn profile and see about connecting with them. So I'm pretty easy to get in touch with, and I'm reasonably responsive.
Well, again, thank you very much, Dr. Mark Tager. Have a great, healthy day.
You too. Thanks.
And thank you for listening to the Women's Heart Health Summit.